I think it really depends on what we're talking about, and I apologize, I'm not trying to make broad-based statements, but my mindset was talking about inpatient medicine. So when you're in the hospital, I think the video is critically important. I think it's incredibly important to be seeing that patient, whether it be in the emergency department, whether it be in the ICU. It's very difficult to do that over the phone. Right? Now when we're talking about outpatient medicine, I think that's a completely different realm. So in outpatient, I think store and forward or asynchronous telemedicine clearly has a role. Clearly been shown to be beneficial. Now, that takes us to a completely different realm of which is now the direct-to-consumer medicine. And I think the direct-to-consumer medicine, I think the audience is still unsettled. I think consumers are looking for a better way of accessing healthcare, and I think there's a tremendous amount of variability. I think there's those organizations that are really ingrained in quality of service and making sure that their direct-to-consumer medicine is really a quality of service product. I think there are other organizations that may not pay so much attention to quality of care, and I think that's when you see different outcomes. You see so much variability that the consumer is just confused at this point in time, and I think you hear across the board either they love it or they aren't in favor of it, and I think you really have to do your due diligence and make sure that the organization that you're working with or the company that you're working with is really based on healthcare quality and quality of delivery of healthcare. I don't think it's necessarily an age gap. I think it's a comfort level with technology. Right? Now, obviously, those individuals who are just coming into medicine or just getting into training, they're very comfortable with doing video conferencing, right? On their phone, on their tablet device, on their computers. So they have a natural understanding of the technology, and they have a very comfort level with the technology. I think our more seasoned physicians have to develop that comfort level. That takes a little bit of time. It's not unsurmountable by any means. At Telemed we have several senior physicians who are outstanding telemedicine providers, but they've had to develop that comfort level. So there's an advantage, as always, among many things, of being young. What you need to understand is that telemedicine is not simply about putting a person in front of a video system and saying, okay, practice medicine. They really have to be taught. They really have to understand the nuances of practicing telemedicine. And I think that does take time, and it doesn't matter whether you're young or old. I think there's a great challenge ahead on how we face the increasing healthcare demands and healthcare needs, both from the individual patient side to all the way to the population health side, all the way to the regulatory side. And I think telemedicine has a role in all of those. We're not looking to replace healthcare, replace bricks and mortar healthcare. By no means. We're looking to enhance it. We're truly looking at telemedicine as a vehicle to increase access to healthcare. We're a 100% telemedicine-based multi-specialty clinical practice. We don't do any bricks and mortar work. So we work in the inpatient setting, we work in the outpatient setting, we work with skilled nursing care facilities, and we do correctional medicine. So what we're excited about is just expanding our role. We're also very, very excited about asynchronous medicine. So we have an opportunity to really make a difference. I think our antimicrobial stewardship program has really shown that telemedicine has a role, that with the new CMS proposed legislation, I think that the expansion of telemedicine-based antimicrobial stewardship offers one of the most salient solutions to this gap of needing antimicrobial stewardship at every healthcare facility, acute care healthcare facility in the United States, and a paucity of experts to do that. This is a real solution that's available now.